coming to our first CONNECTpreneur Premium. I think we've done 60 in-person events in the last 12 years, and we are blessed to be here at a very, very nice club. And where's Nishod? Nishod, are you here? Okay. Nishod's batting leadoff. Let me text him. Hang on one second. Thank God for technology. Okay, I wanted to highlight some of our events coming up, not just ours, but other people's. We have Blue Ventures Cyber Summit. It's their annual summit. It is on October 19th, and it's at the Bethesda North Marriott. It's an all-day event, and the website is blueventureinvestors.com. And there should be some people from Blue here. Anyone from Blue in the audience? No? Okay. Well, blueventure.com. That's their website. Blueventureinvestors.com. Next, we have the Asian American Chamber of Commerce, and we have Michelle, who's the Director of Operations, right back there. They have their 14th annual business summit. It's from 9:30 to 3 at KPMG in Tysons. Asian-AmericanChamber.org. Right, Michelle? Thank you. Okay. November 1st and 2nd, we have Accelerate 2023 conference. It's George Mason University. It'll be in Arlington, and the second day, the gala will be in DC. So for those of you, this is their third annual event, and hopefully you guys will participate. Where's TJ? TJ right there, and Becky right there. We got some representation from George Mason, and the website, TJ, I have as acceleratedeals.org. Is that right? Okay, fantastic. And I think there's some members of the audience that will be pitching there too, so that's great. And then we have CONNECTpreneur.org. That's our website, and from October 25th and 26th, we have two 90-minute virtual events. It's free, so we will have 4 presenters at each event roughly, so please do sign up. Also on your chair are some QR codes that list some of our upcoming events, as well as the list of attendees and our awesome prep team. Also, November 8th, we'll be in Baltimore in the morning at the Johns Hopkins Carey School of Business downtown, brand new building. We have the whole floor, so please sign up for that. And December 18th in Tyson's Corner at Refraction. That'll be the evening. We have Northern Virginia Tech Council, Jen Taylor, who's our partner. Thank you, Jen. So be sure to sign up for that. So without further ado, I'd like to bring up Nishod, if he is here. Nishod, are you here? Jeff Browse, are you here? Come on up here and say a few words about the City Club. Oh, he is? Okay. All right, here he is. Let's give it up for Nishod. Making a grand entrance. Nishod is the general manager of this beautiful club. For those of you who are members of the Tower Club, this is a sister club, and it's run by invited clubs, and it's first class, as you know. I've been coming here since 1986 when they opened. Yeah, a long time. And it's always been a top-notch club. It's a respite. I think it's like an oasis in the city, you know. After you deal with 2 hours of driving traffic, you can come here and relax. But please join. Nishod's got a great deal for us, hopefully, right, our audience. But please say a few words, and let's give it up for Nishod. Thank you.
All right, I promise I'll make this quick. Thank you all for coming. Welcome to the City Club of Washington. I wasn't here in 1986, so I apologize if I don't reciprocate what he's saying. But I try to make this an oasis for everybody. I mean, if truth be told, we're the only club here in the entire invited network that is, you have to go down. Every other club you go up. So I got something going for me with that, right? So again, thank you all for coming. I just wanted to let you know that Tian and I worked out a deal where we'll have Jeff outside by the membership post. Everybody knows Jeff, so he'll be my salesperson for today. We're offering membership to anyone who's looking to sign up, and we reciprocate everything that Invited Club has to offer. The great thing about this offering is that you'll get the same benefits you get here, you get also at Tyson's. I was smart enough to do that with the GM. He doesn't know yet, but we won't tell him. But you'll get the same 50% discount reciprocated there as you will here. It is for young executives, and that's 40 and under. You'll pay $193 a month with $250 IF. You'll see, and forgive me for this, you'll see on the packet it says 500. It's 250. And for the resident who's over 40, that's $296, and you'll pay $500 initiation, one-time initiation fee. If you do decide to sign up either today or by the end of the week, I will waive the November dues for you. So that's an added benefit that will add to you if you do decide to sign up. I'll give you the entire week. So I won't say 24 hours or 48 hours. You have until the end of the week. The end of the week for me is the week ends on Sunday. As you all know, for you the week starts Sunday, right? For me it ends on Sunday. So I'll give you until Sunday. And I'm sure Tian will call me and ask me, there's somebody who missed it and they want to come on Monday and Tuesday. I know how we work. I mean, I've been in the system long enough. I've worked at Tyson's for 9 years. So they decided to pluck me out of there and put me here. They'll be like, we'll put you downwards and see where we go from there. Hey, the best thing is the only way I can go is up, right? So thank you very much. Again, please enjoy. And if anyone needs anything, please see me.
Yeah, it's been great to be a member of the organization for, 15 years, but you get to play golf in California. They manage hundreds of clubs around the world, including the top club in Beijing. And it's actually quite good, especially if you travel. All right, enough advertising, Nishod. We'll get on with the show. I do want to thank our great partners. So they're listed on the back of our book. We have Next, powered by Shulman Rogers, AEG, Buzzy Rocket, NFP, New York Life, Entrepreneurs Organization, Blue Venture Investors, Startup Grind. We have Beyond, NABO, Ryan and Wetmore, FITSI, Kobe, Keiretsu Forum, Maryland Tech Council, Enterprise Transformation Solutions, the annual Wharton DC Summit, Institute for Excellence in Sales, Robert A. Smith School of Business, the Dingman Center, Georgetown Entrepreneurship, U.S. International Development Center, the Baltimore Angels, and Founder Institute. Let's give it up for our sponsors. Thank you, guys. Okay, we have 6 presenters, so that's part of the premium program that my team wanted to do. Smaller group, more investor networking with presenters and entrepreneurs. So we only have 6 presenters. There'll be 4.5-minute pitches. To introduce our first 3 presenters is our longtime partner and sponsor, Mr. Anthony Millen, who's really busy this week with DC Startup Week. But Anthony's the founder and chair of Next, powered by Shulman Rogers, which is a very innovative law firm, one of the most innovative in the country, as they've garnered quite a few awards from Legal Week and American Lawyer and some other top-notch journals. But they offer fixed price programs, which is really good, as you know, for those of you who have run startups, that legal can be very expensive. But in the case of Next, they do a fixed price, so you kind of can budget properly, et cetera, with top-notch attorneys. So they're not going to sell you and then throw you to some associate, like some people do, unfortunately. But anyway, Anthony, come on up. Anthony's going to introduce our first 3 presenters. So let's give it up for Anthony. Thank you.
Great. Well, it's great to be here. Thank you, Tien and Skylar and the whole CONNECTpreneur team for all that you do for our ecosystem. And you're constantly innovating, starting out regionally and expanding globally during COVID, and now with this premium offering today. It's great to see how you continue to evolve. Just briefly, as Tien said, Next is an innovative new model for delivering legal services for startup and emerging growth companies. We've productized a broad range of legal services to provide predictability for startups. We've changed the way customer service works in the legal industry, and we use a lot of technology to make things much more transparent, much more collaborative, and much more efficient. And we're also constantly moving to try fulfill our mission, which is to empower startup success. And so above and beyond legal, we continue to offer new solutions to the market. And our newest one is called NextRaise for people who are investors in the room. NextRaise is built to really help startups be investor ready and to make the connection between investors and founders more scalable. We've done one NextRaise event earlier this year, and we have one tomorrow where we'll be connecting. There'll be 50 one-on-one investor meetings with startup companies selected by investors, 15 VC funds as part of the DC Startup Week effort and NextRaise. So just something. And for information on us, you can find us at next.law or info@next.law, and please feel free to just reach out. So the first company that I have the honor of introducing today is Aged Diagnostics. Aged is developing the most accurate blood test that can differentiate benign from advanced liver disease and simultaneously stage fibrous liver scarring through a targeted genomic sequencing assessment. Please welcome Rachel Zaya, CEO and founder of Aged Diagnostics.
Me? Hello, my name is Rachel Zayas. I am the founder and CEO of Aged Diagnostics. Our team is working together to create the first accurate blood test for fatty liver disease. When I was working at MIT in cancer research, I realized that the tools we were using were not being well translated into the clinic. Did you know that we can take a nanoparticle and send it through the circulatory system to target a specific organ and release a therapeutic in a orchestrated manner, but we cannot use that same circulatory system to determine when one of the most important organs is in trouble? Next slide. The liver. The liver has over 500 functions. It is the only organ in the human body that regenerates, and one cannot live well without a healthy functioning liver. Next slide. Did you know that 1 in 3 Americans, or 100 million people in the United States, have fatty liver disease? This disease is not associated with alcohol consumption, but rather diabetes, obesity, and metabolic syndrome. It is called non-alcoholic steatohepatitis, or NASH. Many patients are unaware that they have NASH until the disease has progressed to later stages, when it's no longer treatable nor reversible. The reason for these trends is that there are very few effective, non-invasive diagnostic tools that can differentiate the benign from advanced form of fatty liver disease. Imaging tools are inaccurate. These tools fail in up to 60% of patients. The sole diagnostic test is a liver biopsy. These are expensive, invasive, prone to sampling error and bleeding. Therefore, they cannot serve the population at large. At Aged, we're developing the first accurate blood test to be able to differentiate the benign from advanced form of fatty liver disease. Our tools will help hepatologists improve patient outcomes, reduce the financial burden on health insurers, and aid in early detection and intervention. Here's how our technology works. We take a patient blood sample and we isolate very specific biomarkers associated with liver disease as well as liver damage. We quantify the concentration of these biomarkers through a targeted sequencing assessment. And past a defined concentration, we can say with a high clinical accuracy if the patient currently has liver disease and what stage. The market opportunity is vast and growing. Globally, there are more than 2 billion patients who are considered high risk and require routine liver screening. Each year, health insurers in the United States spend more than $100 billion on direct management for this specific type of liver disease. Aged seeks to capture 25% of the US market, which equates to more than a $27 billion market opportunity. We have multiple patents pending, both on the biomarkers as well as the methods to assess these biomarkers synthetically in circulation. Our competitive advantage is that we would be the first accurate blood test for NASH. We'd be less expensive than the gold standard, which is liver biopsies, and less expensive than imaging modalities. Last but not least, we expect to be the most accurate tool for decades to come by targeting highly innovative genomic regions. We have had exciting traction to date. We've recently completed several pilot studies and identified a set of biomarkers that have between 90 and 99% efficacy, differentiating between the benign and advanced form of fatty liver disease. We've recently partnered with the Henry Jackson Foundation. This is a congressionally mandated nonprofit focused on the advancement of military medicine. We have multiple clinical trials ongoing with Walter Reed Military Center and Brooks Army Medical Center. We expect to launch by Q1 of 2025, where we will deploy our tools in the DC, Maryland, Virginia area as a service. We are the team poised to take this technology to market. We have 100 years in hepatology, 75 years in business, 50 years in genetics. We've had 5 previous exits and closed on more than $125 million in funding to date. Once again, we plan to launch into the market by Q1 of 2025. In year 1 of operations, we seek to capture 3 physicians and reach 5,000 patients. Our tools can be reimbursed at a rate of $700 per patient per test. In year 1 of operations, we can generate $3.5 million in revenue. By year 3, we plan to pursue FDA approval, and by year 5, we plan to exit with some of our current partners. We are raising $2 million in order to get through test method verification, test method optimization, and several business development milestones. We are hungry, humble, and yearning for progress. Our mission is not only to help patients age, but look back and say that they have aged gracefully. Thank you.
Thank you, Rachel. I now have the privilege of introducing Coagulation Sciences. Coagulation Sciences has developed the multiple coagulation test system. The system performs 12 blood tests simultaneously in a disposable cartridge in 10 minutes at the point of care and determines which treatment will stop bleeding. Please welcome Sheldon Goldstein, CEO of Coagulation Sciences.
Next. So our mission is to obtain better and faster control of major bleeding and to reduce unnecessary transfusions, thereby improving patient safety and decreasing healthcare costs. So at least 40% of transfusions are unnecessary. There are actually studies that show the rate of unnecessary transfusion is as high as 59%. This happens because during major bleeding, doctors do not have tests available that can give them sufficient information to make good decisions about what to transfuse. And we know from multiple studies that have been done that if you can decrease transfusions, you actually improve patient outcomes and decrease hospital costs. This is a photo of our actual automated prototype. This is the disposable cartridge, which at scale has a 73% profit margin. We want to replace the top of the slide where a tube of blood goes to a lab or more than one tube. Lots of people have to interact. Test results can take an hour or more to come back. With our fully automated system, this is done at the bedside, multiple test results, 12 minutes, and we give information not currently given by any other test platform. We can indicate which therapy will stop the bleeding. No other test on the market can do that. And no other test is in development to do that. Top of the slide, these are the risks of transfusion. A whole long list of them. There's actually a study in heart surgery showing a dose-response curve. Each additional unit of blood shortens a person's life. No, go back. Bottom, there are hundreds of research studies showing the complications of blood transfusion. I'm only highlighting one because this study has over 1 million patients in it. And people often say, well, of course, the person who got the blood is sicker. No, this study was one of the ones done really well where they had beautifully matched controls, meaning you have 2 patients, same disease state, same age, same state of health, same surgery, one got blood and one didn't. Of the patients who got blood, cost of hospitalization and length of hospital stay is longer, risk of an infection 90% greater, risk of death 70% greater. I consider death a very bad outcome. These are testimonials from key opinion leaders. Aryeh Shanda was labeled a hero in medicine by Time magazine for his work in bloodless medicine. He wrote that by testing therapies in advance of treatment, only the therapies proven to correct clotting would be administered. Dr. Spiess, a specific test to tell us how to treat the patient. Dr. Ness, Senior Director of Transfusion at Johns Hopkins. We'd have great interest using this at Johns Hopkins, and I believe other hospitals and their transfusion departments would share my enthusiasm. We also have an independent market research study. Okay, we're missing a slide that has, it's an independent market research survey and surveyed physicians who care for patients, cardiac surgeons, anesthesiologists, blood bank directors who made the same points as the key opinion leaders. One of them actually wrote that, it's exciting that such a thing even exists. We projected our sale price at $300 to $400 per cartridge. There was no pushback on that. And of note, hospitals get reimbursed mostly on a DRG basis. On average, they lose $800 each time they give a unit of blood. So it pays for the hospital to use this technology. This is an example of a fully automated result with our current prototype, which was used in a pilot study at the Mayo Clinic. This is laboratory data. We created a sample that's missing prothrombin factor 2. Rows 1 and 18 are the abnormal sample alone. Blue bar to the right, no blood clotting. Rows 2 and 9 through 17 all have treatments that are given to improve blood clotting. And despite that fact, none of them results in a clot because they're the wrong test. Everything in the green column is an effective therapy. So you see the results instantly. Next slide. The left is an algorithm. This is what's recommended now in the journals. Use 3 different tests and go through as many as 15 decisions. When you're an anesthesiologist caring for a bleeding patient, you don't have time to do that. We can go through our team at another time. You can read about it if you ask for materials. We're seeking $2.1 million. This will fund us through a Series A raise. Next slide. Projecting revenue in excess of $70 million in year 4 of sales. Next slide. Multiple additional intended uses after cardiac surgery. Next slide. Next slide. And these are potential acquirers. Acquisition is extremely common in this space. Thank you for your time.
Great, thank you, Sheldon. All right, I would now like to introduce Couple.com. Couple.com is poised to revolutionize the $10 billion online dating industry with the highest quality user data derived from real human interactions and user labeling. Couples' patented online singles parties offer a fun experience with genuine connections and cutting-edge AI matching. Please welcome Ryan Beswick, CEO and co-founder of Couple.com.
All right, good morning. I'm Ryan Beswick, CEO of Couple.com. We're redefining dating with our online singles parties where we collect the highest quality data to drive AI matching. I want to tell you all about it. So online dating doesn't work for most people today. Only 16% will find the relationship they're looking for after a year on the apps. There's a number of pain points. It begins with unreliable data. These apps use data based on self-reported forms. They're biased. People embellish their profiles. Next, users are matched in a very superficial way. They look at profile pictures. If they don't like what they're looking at, they immediately swipe on to the next one because they know there's like an unlimited number of profiles sitting behind it. And finally, there's loads of user safety issues. Consumers were tricked out of 1.3. Consumers were tricked out of. Consumers were tricked out of 1 point. I really wanted to emphasize that point. Consumers were tricked out of 1.3. I'm just going to talk really loud. Pardon me? Oh, well. All right. The user spent $1.3 billion on romance. I don't know what to do. I mean, all right. I think we've got it now. All right. So maybe it's too close to my mouth. All right. Can I get an extra 30? All right. So in 2022, consumers were tricked out of $1.3 billion in romance scams. And it's only getting worse with generative AI, where it's easier than ever to create fake profiles and run scams in an automated way. This is getting worse by the day. Next slide. So we've seen since the dawn of online dating evolution every decade in terms of a new generation of apps. We haven't seen anything new since Tinder over 12 years ago. And so with the pain points in the industry today and all the new technology available, we're poised for a major shift. Next slide. So at Couple, we host online singles parties. There's two main experiences. It starts off in our group mingle rooms, where we have entertainment, musicians, comedians, interactive games, group mingling. And then we pair users together on one-on-one speed dates. After each date, they'll answer a series of questions to give us information about the person they just dated. So personality ratings, appearance ratings, we understand their preferences. So we collect data throughout all of this. Next slide. And so with the data that we're getting and the experience we're delivering, we're fixing all the pain points in online dating today. So our data is reliable because it comes from these real human interactions at our online singles parties. We connect people in a very meaningful way, much deeper than looking at a profile picture. You're seeing how people are speaking, how their body language, etc. And then user safety is not a problem with us. We don't have the bots, we don't have the scammers. You've got to be live on camera. So it's safe to find a romantic partner on Couple. So this is just, I'll quickly touch on this. I'd love for you to drop by my table and I can go into more detail and give a demo. But this just shows all the data and how it feeds our AI matching engine. The audio and video from the party rooms and the dates gets recorded, and it gets put through several different models of expression analysis. The audio gets transcribed, and we analyze that transcription in a number of ways. All of that gets combined with our user labeling. So those are the match decisions, appearance rating, personality ratings. And so we use that to drive our AI matching. Next slide. And so we've done 200 experience tests so far. We've been at this for 3 years. What we're seeing has got us ecstatic. 82-minute average engagement time. So if you come to one of our parties, on average, you're there for about an hour and a half. That puts us on par with apps like TikTok. We get a 92% positive rating. We've received a patent for our interactive video technology that makes this whole experience possible. We've got 3 provisional patents in for our AI tech, and we can handle events at scale. All right, so we have a few advantages when it comes to user acquisition. I'm sorry. We're going after the $10 billion core dating market. It's expected to grow to $16 billion by 2030. And because of the entertaining aspects of our event, we see ourselves touching dating adjacent markets as well. People spend a fortune at bars and nightclubs and social clubs looking to find a romantic partner. Our initial target audience, 25 to 35 years old, urban, people seeking a serious relationship. So we have a few unique advantages in terms of user acquisition. We stream out our performance rooms. So our musicians, comedians, that all gets streamed to social media. We generate shareable content based on people's experience at the event that they share. Next slide, like 2 or 3 times. So we're starting by launching in New York City this January. We've been flying under the radar thus far. The technology is now ready where we're going to launch, and then we'll expand out across North America over the next 2 years. We've got a fantastic team. Not listed on this slide is Christian Rudder. He's the CEO and co-founder of OkCupid. He led the company through the acquisition by Match and beyond, so he's a close advisor for us. Next slide. So we're raising $8 million as part of our Series A. We've got $2 million committed already. That will fund our go-to-market across North America and help us finish out the AI matching, which will be done by second quarter next year. Next. Well, thank you so much. I'd love for you to join us to make online dating more safe, fun, and effective. Thank you.
The only thing rattling around my head is $1.3 billion. So whatever I was going to say before is gone. My name is Mark Haas. I am the co-founder and CEO of AEG, Association for Enterprise Growth. We are an ecosystem of business advisors and mid-market CEOs. Our focus is on improving the strength and resilience of the mid-market economy in the cities in which we operate. We run small communities of CEOs of 20 million plus and elite advisors who serve them. We operate in DC, Baltimore, and Tampa, and we connect the individuals in those communities as well as the cities together. So if you'd like some more information, COO Rosemary Savino is there, and Jeff Browse. She's waving at you. So she is paying attention after all. Anyway, so we all have to suffer through big data, big tech, big oil, big pharma. Anybody who's got a small, medium-sized business understands the difficulty of getting personalized service that deals with the issues that you have to face day to day. So our first presenter, D3 Unified Communications, has solved that problem by integrating voice and data through MSPs, who there are lots of them, and they provide more personalized service. So I'd like to welcome to the stage Chuck Daniels, CEO of D3 Unified.
All right. Well, I've been known to cause bleeding from the ears with things like this, so please let me know if that happens. All right. So I'm going to start off the morning with your fun fact. It was Mark Twain's character, Tom Sawyer, who created growth hacking when he got all of his friends to paint that fence for him. Because growth hacking is the ability to get other people to do your work for you. Unified communications are business systems that allow two people to communicate anytime, anywhere, with any type of device. D3's secret sauce is our ability to get other people to sell our unified communication solution. We are a 10-year-old profitable company, and we're here to raise $250,000. Thank you for doing the slide. So if you got gray hair like me, you might recognize the picture on the left, premise-based PBX system. What D3 does is we help our customers replace the mess on the left with a cloud-based unified communications solution that they private label, because private labeling is one of the main reasons people's partners select D3 UC. Next slide. So who are our customers? Well, as you can see, they're the folks in the middle. They are called managed service providers, or MSPs. For, again, those people with the gray hair, they used to be called value-added resellers, or VARs. MSPs are VARs who can't sell hardware anymore. So we sell to the MSPs who turn around and white label, private label our UCaaS solution and sell it to the 5.2 million small businesses in the U.S. There are 50,000 MSPs in the U.S. Our mark, is this the next slide? Yes, thank you. Our market is the S in SMB, but that is anything but small. 90% of all businesses in the U.S. are considered small because they have less than 20 employees. D3 targets the MSPs because by targeting them, we get access to a market with 5.2 million businesses and 20,000 phones. We use the MSPs to growth hack the small business market for our service. Next slide. So how do we find these 50,000 MSPs? Well, after 10 years, I hope you'd expect us to kind of refine the process, but we are very good at finding, signing, and getting MSPs to generate revenue for us. When we sign them, we teach them how to market and sell their product. Every time they install a customer, that's another monthly recurring revenue stream that comes to us. And in 90% of our customers, we actually do the billing for them. So that is another high profit stream for us. Next slide. I've been in tech and telecom for 4 decades. I understand my competitors' strengths and weaknesses. They are listed in the box. Their greatest weakness is their greed. They sell both to MSPs and to the MSP's customers. And if there's anything MSPs don't like, it's the private label a product from somebody who is their competitor. MSPs love D3 because we exclusively sell only to MSPs. Next slide. 60 years of tech and telecom right there, and we learned how to use learned how to use MSPs to growth hack the SMB market in the business that we founded in 2005. Next slide. 100% of our revenue is monthly reoccurring. We're going to make our numbers for this month, for this year, and we have had year-over-year increasing revenue since founding. Next slide. We are raising $250,000 solely to grow our team. It is a private debt deal, 5-year note, 2 years interest only, 3 years principal and interest, and I have a special cherry on top for anybody who wants to lend us. If we sell D3UC over the 5-year term, after we sell the company, our lenders would have the ability to decide whether they want their principal and interest back or would they like to convert it into equity at prices I was selling 3 years ago when we became profitable. I have a favor to ask. Please visit us over there. I have got so much Halloween candy. Please take big handfuls because I am not going to be able to stare at it for the next 2 weeks before Halloween. Thank you very much.
Well, this is the next presenter is a story of Goldilocks and the Three Bears as it applies to infectious disease. And I think so. PCR tests are too expensive and they're very complicated. Antigen tests are not as accurate. They can be fairly inexpensive. But what we're looking for is something right in the middle, something that provide a very fast point of testing operation and give you a lot more information. Our next presenter, Novel Micro Devices, has got a technology that does exactly that. And Andrea, there you are. Andrea Pace is the co-founder, CEO, co-inventor, co-everything.
All right, so my name's Andrea Pice. I'm the co-founder, CEO of Novel Micro Devices, and I founded the company after identifying a significant innovation opportunity to provide rapid, accurate, affordable, and simple diagnostic tests to enable results at the point of care and immediate treatment. Next slide. So, the current pandemic and the statistics show that there's a clear need for better diagnostics and better treatment for infectious diseases. But the current tests on the market have trade-offs. The lab tests, like Mark said, are highly sensitive, but they take days for results. They require expensive infrastructure, skilled personnel, and equipment. The point-of-care rapid antigen tests are fast and inexpensive, but they're not very sensitive, so a confirmatory lab test is required. And the point-of-care molecular tests on the market are highly expensive and still not very sensitive. Next slide. We have developed a highly innovative and differentiated solution called Novel DX, and here is why we're different. Novel DX enables lab-level accuracy PCR results to be performed by anyone, anywhere in just 15 minutes or less. And it works in 2 easy steps. All you do is load the patient sample into a test-specific cartridge and then insert that cartridge into the instrument. Results are available in under 15 minutes on the screen, as well as sent to our cloud. And what sets us apart from everyone else is our system is a true platform that works for any pathogen and any sample type. It's extremely affordable, and it's portable and battery powered. Next slide. And we have multiple patents filed. To cover each aspect of our rapid assay workflow, and all of these are company owned. Next slide. And our product is addressing a significant $40 billion market opportunity for infectious diseases. Our key customer segments that we're servicing include urgent care facilities, retail and pharmacy clinics, physician offices, hospitals, and emergency departments. Next slide. Our product pipeline and go-to-market plan is shown here with the first 2 tests on our pipeline for respiratory diseases, that's flu, RSV, and COVID-19, and sexually transmitted diseases, to be launched in 2024. And that has a combined market opportunity of $12 billion. Our strategy for all the tests in our pipeline is to start with a controlled launch as a lab-developed test, or LDT, to start generating revenue immediately, and more importantly, data, while we wait for regulatory clearance to enable a full-scale point-of-care nationwide launch. Next slide. And to meet our product development and launch timelines, we have a highly experienced leadership team with decades of experience in product development and commercialization. Myself, Rohan, and Hamdi are the co-inventors of the technology, and several of our key members have worked and commercialized products at large diagnostics companies. Next slide. And we've raised 14.7 million in capital to date, and that includes 2.5 million in founder capital and 7.7 million in non-dilutive funding from extremely competitive grant funding sources like NIH, CARB-X, and RADx. With this funding, we've achieved milestones such as filing our key patents, establishing manufacturing capabilities right here in Baltimore, and demonstrating the performance capabilities of our platform for infectious agents like respiratory diseases and STDs. Next slide. We're currently raising a Series A $6 million equity raise. We plan to close the first 3 by the end of this year, and we have $1.6 million committed. The Series A raise will enable us to achieve system design lock, assay design lock, verification and validation studies, and implementation of our pilot manufacturing, which will get us to our controlled launch phase. And we've also submitted grants for over 27 million to grow our pipeline and grow our manufacturing. Next slide. And finally, our company is an attractive acquisition target for a large diagnostics company. Curiosity Diagnostics was acquired by Bio-Rad for 170 million, and they were at pre-revenue design lock, which is at the same stage we will be after we've completed our Series A raise. Thank you all for your time, and next slide.
Okay, our last presenter, in the 2 decades since we first sequenced the human genome, we've come to appreciate there are about 20,000 genes that are or may have some impact on human health. Every time something comes up and say, well, what genes are involved in that? So 10 years from now, we're going to have pretty much worked on or solved a lot of the monogenic gene problems, but it's a real challenge now figuring out how to get to the laboratory and understand what's going on with multi-gene diseases. Our next presenter, Osprey Bio, has figured out exactly how to do that with some pretty clever technology. I'd like to introduce Sam Glickstein, co-founder and CEO of Osprey Bio.
Thank you. So my name is Sam Glickstein. I'm the CEO of Osprey Bio, where we create biotools to simplify complex biotherapy development. Next slide. So everybody knows somebody who's been affected by something like Alzheimer's, a very complex disease. The problem is that we've spent billions of dollars and decades of time to research a cure, but we're not even close to finding out how to actually cure something like Alzheimer's. Next slide. And the reason why that is because when you look at what's in the clinic right now for cell and gene therapy, which is new, it turns out that the majority of what is in the clinic are single target or single gene therapies for small patient populations, rare diseases. And these treatments or therapies cannot have any effect or just don't have any effect on something complicated like Alzheimer's, which kills the most people, you know, the cancer, heart diseases. These kill the most people, these complex multi-gene diseases. Next slide. So the real question is, you know, why at this point in 2023 do we not have something that can actually have any effect? Where are the complex multi-gene treatments? And the answer is simply that there are no accessible tools on the market to allow researchers to actually build these complex therapeutic candidates. Next slide. So Osprey, we take that very seriously. We are introducing the clone card, which is a very simple device that, next slide, is powered by our bird of prey system. And in layman's terms, every single tab on here has an important gene that researchers can actually take and plug and play into a larger vector backbone. So it's a tool that allows researchers to build very simply a complex multi-gene therapeutic candidate. This is the first platform and product like this on the market. Most importantly with this is that it does not take genetic engineering expertise to wield, to use, to actually build something meaningful. Next slide. What this translates to is something like this. 3 different cards potentially for neural effectors, but we end up having thousands, actually it's not thousands, it's millions of different possibilities that will allow you to upregulate, downregulate different genes at different times, different promoters. This is blowing open the door with orders of magnitude more possibilities. Competitively, we are positioned extremely strongly. We have very competitive prices, if not the cheapest on the market per gene. And again, the biggest point is that it does not require expertise to use. Next slide. Next slide too. So the market we're going after is actually all the discovery tools in cell and gene therapy. Everybody in this space that we're going after is in R&D, which is a huge market. It's $5 billion right now for cell and gene therapy specifically, but this is growing by leaps and bounds because cell and gene therapy is a new and extremely fast-growing market. Next slide. Revenue, we're looking at breaking even, profitable at year 3, driven by all these different kinds of revenue streams from product single sales, razor blade models. Next slide. And I included this just to show that biotools is a very exciting, dynamic market, a lot of acquisitions in the space. We believe Osprey is in a prime position to get to that point where we are acquirable with significant revenues. Next slide. We're asking for a $1 million seed round convertible note, mainly to drive a significant expansion of our product line and an extremely aggressive, which we have all planned out, sales and marketing push to all R&D entities in the country. And we're also looking to develop partnerships. We've got some number of exciting ones. Next slide. One exciting one I'd like to point out to preemptively put the AI question to rest. Yes, we are working with somebody to develop the data set for multigenic diseases and genes and candidates. Catalytic Data Science is a bioinformatics company we're working with. We have a lot of exciting things going with them. Next slide. Our team, a lot of biotech experience, a lot of entrepreneurship experience, a lot of biotools experience, very good stats. We're very privileged to have our board directors on board with us who are big heavy hitters in the space. Next slide. Yep, thank you.
Thank you, Sam. Great job. And I want to, let's give it up for all 6 of our awesome presenters, please. It's really amazing to see what everyone's doing. I think we have at least 3 potential unicorns out of the 6, maybe 6 out of 6. But we have the place for another hour. So thank you, Nishod and Jeff and team for letting us enjoy the place. And thank you guys for coming. Again, CONNECTpreneur.org has our next 2 virtual events and our next 2 in-person events. So thank you guys for coming. And yeah, we'll see you soon. Thank you.